Hey guys, welcome back to Defeating Hair Loss. My name is Steve, and tonight, guess what we're going to talk about? Hair transplant scarring. I am super passionate about this, but I'm going to warn you, before I get started in this video, whenever I talk about FUE and FUT, it always sounds like I'm trying to promote FUT. I am absolutely not. This is an objective video. The content is just objective. There's no promoting FUT over FUE. But I'm kind of sort of leading the witness here because that's what it's going to sound like. So it's very important that you think through which procedure you choose when making a decision for a hair transplant. So let's get started. So this is my drawing. I didn't ask anybody to do it for me. And I know the heads look a little big, but it makes it, I think, more real. And the scarring is extremely discussed. It's extremely concerning to the patients, especially the younger patients. One of my biggest now pet peeves is when patients choose FUE and they're led to believe by many places online promoting FUE that there will be no scarring. Now in the fine print, I'm sure it will say you're going to have tiny little dot scars versus a straight line across the back. So this line right here on the back of the head is where the FUT scar would be taken. These little initials is the occipital bone. So in that area, right, the little bump in the back of your head, you can put your finger on the back of your head while you watch this video. That linear scar, if you choose FUT, is going to go straight across the back. This zone above and below that occipital bone is called the safe zone. And if you look, turn to the side, the safe zone comes up over the ear. Now, this is where it gets a little bit complicated, okay? You really don't use in the industry the board certified doctors that are doing this ethically and honestly. They are not going into the bottom area under the safe zone. That's called nape hair. And they're not going above because what if you go bald? And what I didn't do here was put like a bald spot up there that can dip down, and it can continue to dip if you're not taking the medication. About 99% of the time, if you are taking the medication, it won't happen. But what we don't want to do is charge you all this money and take out hair in the zones that are not considered safe. I hope that makes sense so far. So when you remove the very best hair, which is in the center core, over the occipital bone via FUT, you're getting all the best hair on the back of your head. It is the most dense hair, it's all packed, and then the area gets closed. So if you take out, let's just say 3/4 of an inch, which seems like a lot, and then you close it with a suture, the hair that's above the occipital bone or the suture line and the hair that's below is all intact. So now you have all that donor hair that is left for a second or maybe even a third procedure via FUT. However, you know what I'm going to say next is you're going to have that scar on the back of your head, which all you guys and girls out there now don't want. I get it. My problem is that based on a lot of different things, you potentially could be opening yourself up to having scarring that you're not going to like, even when you do FUE. And that is because if we stay inside the safe zone and come up over the ear, and we're doing punches, let's just use 0.8 millimeter, which is what a lot of the average hair is what we use in the industry. You're going to have 2,000 tiny little punch biopsies, which means in that safe zone, from top to bottom and over the ear, you're going to have hair that's taken out. Now, the average follicular unit is about 2.5 hairs per follicular unit. Some, you'll go somewhere and they'll tell you got 4s and 5s. Maybe some, but it's 2.5 is the average. Let's always use the worst case scenario. If you multiply that by 2,000 grafts, you're looking at about close to maybe 5,000 hairs. So in this entire zone, and then up over the ear, you've taken out 5,000 hairs. Now it depends on the color of your hair and the color of your skin, and it depends on your density. How many hairs per centimeter squared do you have in that donor zone? You could be a Middle Eastern guy and have 250 hairs per centimeter squared. You could be a Spanish guy and have 280 hairs per centimeter squared. You could be African American or African descent globally and have 150. Not as much. It's really good hair, but it's not as dense. These are different variables. I have poor hair. I have Western European hair. I probably have somewhere around 180 hairs per centimeter squared. The advantage I have is I have light hair and light skin. So where am I going with all this? If you have dark hair, I'm just using one example. If you have dark hair on light skin and you go through this entire zone with FUE and you extract out 2,000 grafts and you have adequate density but not strong density, you may have an impression once this is all healed up that that center zone is lighter. It almost looks a little moth-eaten than the rest of your head, and you're going to be upset about it. Don't be upset about it because I'm educating you on what's needed to go into this surgery. There's no way, what do you want the doctor to do? You want the doctor to uniformly take more hair outside the safe zone, then maybe that hair will fall out? Because that's what they do in these foreign countries when they take 6,000 grafts out. The entire back of the head, yeah, it's uniform, but they've taken all the hair out. So now they've got all thinness in the back. And of course, they're only using the examples of these guys with the super dense hair. So don't let the internet information give you the cherry picking, which is my pet peeve word. It's only the best cases, and let you, young man, young woman, or any age, think, hey, as long as I do FUE, you're never going to be able to tell in the back of my head when I cut it real short that I had a hair transplant. Yes, it may happen. Because my question out there, and I'm not frustrated, I'm just passionate, is what do you think is going to happen when a boatload of hair is taken out of the back of your head? Now we go back to the FUT, and it seems like I'm promoting it. The advantage is when you take out hair that way, which is straight across, and close it, you don't miss anything. So now this is not diffusely thin, this is not diffusely thin, this is not diffusely thin. However, you got that linear scar. So you kind of have to pick your poison. You have to understand that results are going to vary. Yes, you're choosing a board-certified doctor. Yes, you're choosing a doctor that's been doing this a boatload of years. Yes, you're choosing a doctor that has done tons of cases, both FUT and FUE. And now it's a month post-op, and you're seeing lighter zones in the back of your head, and you're wondering why. What happened? Maybe my doctor had a bad day. Sir, son, ma'am, hair loss patient. You've had a boatload of hair taken out of the back of your head. You've got to pay that price to some level. Yes, it's done with very delicate and it's done very carefully. And the word overharvest is thrown around out there. You can't overharvest if you take out a small amount of grafts, but if you take out a ton of grafts, I'll just throw numbers out there like 5,000 FUE grafts, 6,000 FUE grafts, that's overharvesting. And again, we've got to keep it in the safe zone. So be very careful what you wish for. These are the questions you should be asking your doctor. And your doctor should be telling you that yes, the potential for you, son, to have scarring, that it can be shown even at a 2-guard or 3-guard from FUE is there. Depends on how you heal, and it really depends on your density. So be very, 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 very careful. I'm always looking out for you. I hope this helps. Don't forget to like and subscribe.